How do you recognize and manage diabetes associated with immune checkpoint inhibitor therapy? So with immune checkpoint inhibitor therapy, ICI therapy, remember the side effects are different than with chemotherapy. We want to pay attention to any prior illnesses you have, especially if you already have a diagnosis of diabetes. Whether you're insulin dependent or you're taking an oral glucose medication, we want to be aware of that because we want to check your glucose levels more regularly because there's the potential for inflammation of the pancreas, so that can disrupt the function so that you can have increases in your glucose levels or even decreases, so the hypoglycemia. So both of those can cause very unpleasant side effects. So for instance, if your experience is increase in thirst, increase in urination, if you notice that you have nausea, fatigue, you're just not feeling well, well, that's important to know because your glucose could be very elevated. And so in some situations, we need to give you insulin. So we would obviously stop the ICI therapy and treat the hyper or the high glucose level until that has normalized. For those of you that are taking oral medications, we may need to switch temporarily to a insulin medication for those of you that have an elevated in your glucose level. But the important thing is to communicate with us on how you're feeling. So symptoms could be very subtle. Once again, you know, you're feeling thirsty, you're feeling tired, increase in urination, things like that, you need to let us know. But the onset of a high glucose level could be very quick. So an hour ago you felt fine, and then all of a sudden you have this cluster of symptoms. So you would need to call us immediately. In some situations, if you would, you know, be vomiting and somnolent and really not feeling well, we would have you go to the emergency room. But these things are treatable and manageable. But the important thing is to let us know. So it's important to call us and let us know of any changes in these symptoms. Now, in some situations, patients may need to transition from oral glucose medications to insulin therapy. And that will be individualized, and that's not going to happen to everybody, but it's important with communication that we are letting you aware of these potential side effects that can occur with ICI therapy. But communication and talking to your healthcare provider at the earliest sign of symptoms will make this be much more manageable and treatable.